bad headache disorder is known as migraine. During this disorder, people experience one-sided headaches and severe pain. The exact cause of migraine is still unknown, but dark light, changes in emotions, sudden stress, and harsh sounds could trigger migraines. Migraine is age and gender specific. There are two main types of migraines, with a headache or without a headache. Symptoms of migraine vary depending on at which phase the individual is experiencing it. A study reveals that almost 12% of people in the United States experience migraines. Although this is a more painful condition for people who are experiencing it, it could be prevented by changing their lifestyle, as it's not a fatal disease. Let's explore its diagnoses, treatments, and preventive measures. What is migraine? A migraine is a primary headache leading to throbbing pain on one side of the head. Nausea, vomiting, and fatigue or irritability are the symptoms of this disorder. Light, sound, and physical movement are some factors that trigger migraine symptoms. The attack of migraine could last from 7 hours to 72 hours. Sometimes, the affected person experiences the symptom of aura before or after the attack of headache, which includes disturbance of vision and tingling on one side of the face or arm. Migraine is a disruptive disorder, so it could affect your personal as well as social activities. Migraine usually occurs at walk time or early in the morning. Some people's migraine occurs at specific periods, such as before menstruation, on weekends, or after stressful periods. People usually feel migraines when they are tired, but they feel okay before and after the attack. What are the types of migraine? There are two main types of migraine, such as migraine with aura and migraine without aura. Migraine with aura. A migraine aura is also known as a classical migraine. This includes disturbances in vision and some other symptoms of neurological problems. These symptoms occur before the headache and could last 10 to 60 minutes. In this type of migraine, the person temporarily loses all or part of their vision. The aura can occur at any time. Symptoms of classic migraine include sensation in the abdomen and weekend muscles, tingling sensation on one side of the face or arm, nausea, increased sensitivity to light. Migraine without aura. It is a second type of migraine, also known as a common migraine. It is the most adverse form of migraine. Symptoms of common migraine include headaches simultaneously with mood changes and mental or physical disturbance, exhaustiveness, and increased sensitivity to light and sound. Other types of migraines. Other types of migraine include abdominal migraine, bacillar-type migraine, hemiplegic migraine, natural migraine, silent migraine, ophthalmoplegic migraine, retinal migraine, and status migraine. A migraine during which the child experiences pain in the abdomen and lasts for about 72 hours is known as an abdominal migraine. Children face the same symptoms of migration, like nausea and vomiting. These children may experience migraines in life. Teenage girls are usually affected by bacillar-type migraine, which is linked with their menstrual cycle. They experience double vision, complete vision loss, or decreased muscle coordination. They also face problems while speaking, fainting, and the severe throbbing pain that can be felt on both sides of the head, front, and back. A hemiplegic migraine is a severe form of migraine that could lead to paralysis, which could last for several days. One side of the body is paralyzed before or during the headache. People with hemiplegic migraine face problems speaking, swelling anything, and stabbing sensations. This disorder may run from parent to offspring, and then it is known as familial hemiplegic migraine. When this genetic mutation occurs in the brain, it could lead to an increase in a chemical known as glutamate in the brain. When women are affected by migraines during their period, it's called a menstrual-type migraine. Their symptoms are migraines without an aura, like vomiting, nausea, sensitivity to light and sound, and a one-sided headache. Silent migraine is a type of migraine without headache in which people are affected by vision problems, constipation, and other symptoms of aura without a headache. During ophthalmology, people experience droopy eyelids and pupil enlargement, and their vision doubles, which could last for days or weeks. During retinal migraines, people may suddenly lose their vision and experience a vision disturbance in one eye. During a status migraine, people are so affected by severe pain and intense nausea that they need to be hospitalized. What are the phases of migraine? There are 4 phases of this primary headache. All phases could occur during the attack. Phase 1, the very first phase of migraine, known as the prodrome phase. Premonitory symptoms occur within 24 hours before the occurrence of migraine itself. Mood swings, depression, food cravings, increased urine, and fluid retention are the symptoms of this phase. Phase 2. This phase could be called an aura, where people visualize dark to light, sudden flashes, or heat waves immediately during or before the headache. Some people in this phase may feel like they're having a weekend or being touched by anything. Phase 3. A migraine is a primary headache, but after reaching that stage, it becomes a severe headache or an intense headache, which could be an attack of headache. Phase 4 is known as the postdrome phase, in which people become confused, lasting up to a day. What are the causes of migraine headaches? The main cause of migraine is still unknown, but it happens when anything changes in the brain or genes. Migraines may pass down from parent to child, and changes in weather, exhaustion, and sharp light trigger migraines. Early scientists thought that it happened when any change occurred in the blood flow in the brain, but after research, they came to know that these changes could contribute to the pain but couldn't start it. Studies have revealed that migraines start when overreactive nerve cells send signals to the brain's trigeminal nerve. In reaction, the brain releases inflammatory chemicals such as serotonin and calcitonin gene-related peptides. Calcitonin gene-related peptides lead to the swallowing of blood vessels in the brain's lining. Ultimately, inflammation produces pain. But why this happens is still unknown. Which factors trigger migraines? Age, gender, and family history are the risk factors for migraine. For example, women are more affected by migraine than men. This headache disorder usually starts between the ages of 10 and 40. Migraine is a genetic disorder. If someone's parents suffered from a migraine, he has a greater chance of getting it from his parents. Many other factors could trigger a migraine. These include environmental changes, any change in emotion, sudden stress, sharp noise, a strong smell, and an irregular sleep cycle. Any trauma in the head, smoking, taking medicines regularly, any hormonal change, or fewer meals may also lead to migraines. What are the symptoms that migraine-affected people experience? People having migraines, whether children, teenagers, or adults, face different symptoms at each phase. During the first prodrome phase, people experience some changes as a warning of the coming migraine, which include disturbance in the stomach, stiffness in the neck, depression, food cravings, and an increase in urination. The second phase of migraine is known as aura. People exhibit symptoms that are reversible in the nervous system. Each symptom starts regularly and lasts up to 60 minutes. Vision issues like seeing many shapes or loss of complete vision are examples of migraine aura. Weak faces or one-sided body parts, weakness, beating something in the ear, and problems speaking are symptoms of the second phase. The third phase is known as an attack of the headache. The time of migraine occurrence varies from person to person. Some may experience it once a month, or it may occur several times. At that stage, 80% of people face nausea and headaches. The postdrome symptoms that occur after a migraine attack include dizziness, weakness of muscles, happy feelings, and loss of appetite. How is a migraine diagnosed? Your healthcare provider can take some physical and neurological tests to detect migraines. Your doctor will take a questionnaire about your medical history and your family's health history. A query test may include some questions like, what symptoms of migraine do you face? What is the severity of symptoms, and how long do they last? He can take some tests like blood tests, CT scans, or electroencephalograms to detect the changes in the brain. How is migraine treated? Until now, there has been no absolute cure for migraine, but doctors suggest some medications to stop its symptoms or prevent them from worsening. If you are experiencing migraines, you can manage them by changing your lifestyle. These changes include eating properly, trying to drink less caffeine, and trying to learn relaxation techniques. Relaxation techniques have simple steps, like resting by closing your eyes, then taking a cold cloth, placing it on your forehead, and drinking plenty of water. If these techniques do not help you, then take drug treatment, which is divided into two parts: acute medication and preventive treatment. During acute treatment, you have to take medicine early at the start of pain, so it can lower its intensity and even reverse the functions. During preventive treatment, you have to take medication daily to relieve pain. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.